My name is Lena Hall. I'm a family nurse practitioner student, and today I'll be doing the respiratory examination. First, I'm going to be looking at the patient's general appearance, and I'm going to be looking at any evidence of respiratory distress, which the patient does not appear to be in any sort of respiratory distress. I'm going to observe the rate, the rhythm, the depth, and the effort of breathing. The patient is breathing with ease. I will count the respirations. Okay. Patient has a respiration of 16 respirations per minute. I'm going to assess the patient's color of the skin. There's no cyanosis in the lips. There's no discoloration of the skin. Check their fingers for any pallor or cyanosis. None noted. I'm listening to the patient's breathing. They're breathing effortless, no with ease, no distress, no wheezing, no audible wheezing while I'm listening to them without the stethoscope. I'm going to assess the trachea. The trachea is midline, and there is no swelling, no edema. There's no retraction while the patient is breathing. Assessing the thorax for any deformities or asymmetry. And now I will measure the patient's anterior, posterior, lateral diameter. So I'm going to have the patient lift up their arm. Okay. The patient's anterior, posterior, lateral diameter is 2 to 1. Now I'm going to assess for asymmetric or impaired respiratory movements. None are observed. The patient, as I said, is breathing with ease. Now I'm going to palpate the patient's chest and back, and let me know if you feel any pain. No wincing observed. No. Patient does not vocalize any pain. Palpating the patient's back now. For the posterior. No pain vocalized. No wincing, no signs of pain. Now I'm going to test for chest expansion. I'll be taking my thumbs and placing them on the 10th rib on the patient, and I'm going to press in to the patient's back and have the patient take a deep breath. Okay. Separation of the thumbs, no observed. Divergence of my thumbs, sorry. Now I'm going to assess the patient for tactile firmitis. So as I am pressing your back, I'm going to have you say 99, okay? Yeah. And you're going to do it over and over again as I'm palpating your back.
99, 99, 99, 99, 99, 99.
Okay. No firmitis felt or
99, 99, 99.
Okay, thank you. Absent firmitis, none were felt. Now I'm going to percuss the anterior of the patient. So I'm going to actually do that in a ladder motion. Easier. Okay, and I'll have the patient turn around and I'll do the back. slide, please. Patient's lungs are resonant. Normal lungs would have resonant. If there was fluid in the patient's lungs, it would sound dull when I percussed. Now I'm going to have the patient, I'm going to percuss the back of the patient on the posterior, and this would identify if the patient had their diaphragm, the diaphragmic excursion. So go ahead and breathe normally. Okay, now take a deep breath in for me. Hold it. Okay, so that's approximately about 3 centimeters. So the diaphragmatic excursion for the patient is approximately 3 centimeters. While I have the patient's back to the camera, I will auscultate the back, the posterior of the lungs. So just go ahead and take deep normal breaths for me. Then I am going in a ladder technique, making sure that it's not on the spinal cord of the patient and it's not on the scapula. And making sure that I'm listening to the upper, middle, and lower part of the lungs. Okay, and now I will test the patients for the voice transmission test. So I'm going to place my stethoscope on the patient's, the diaphragm on the patient's back, on the posterior, and have the patient say E, E, E 3 times when you feel my diaphragm touch your skin.
E, E, E.
Okay.
E, E, E.
Okay, and that is testing for the egophony. And now I have the patient whisper 1, 2, 3 upon my diaphragm touching the patient's back, and that is testing for the pectorally. Okay.
1, 2, 3. 1, 2, 3.
Okay. All right, and now I will have you turn around and I will oscillate the front. When I'm oscillating, I am listening for pitch, intensity, and duration of respiratory and inspiratory sounds. So far, there is no wheezing, there is no pitching, or there is no crackles or rails upon oscillation. Okay, and final, I'm going to be doing the voice transmission on the front, and it is the bronchophony testing. So I will place my stethoscope on your chest and you will say 99 3 times. And you feel my diaphragm placed on your chest.
99. 99. 99.
Okay.
99. 99. 99.
All right. Thank you. And that is